This episode is brought to you by Progressive Insurance. Do you ever think about switching insurance companies to see if you could save some cash? Progressive makes it easy to see if you could save when you bundle your home and auto policies. Try it at Progressive.com. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary. Not available in all states.
At Arizona State University, we're bringing world-class education from our globally acclaimed faculty to you. Earn your degree from the nation's most innovative university. Online. That's a degree better. Learn more at asuonline.asu.edu.
Hi, this is Dr. Stephanie Wautier, and I'm the host of Conversations with a Chiropractor. This is not a health how-to, but rather a conversation with some amazing people I've had the pleasure of being with on my journey of life. Think of it more like Tuesdays with Maury, a fireside chat, or chicken soup for the soul. Grab a cup of coffee, sit back, and enjoy this conversation with a chiropractor. Today on Conversations with a Chiropractor, I am joined by Jamie Kitchel. She is a nurse midwife. She is the co-owner of Rooted, a postpartum education and home visiting service. Her co-owners are Heather Sullivan, who is a social worker, and Melinda Britton, who is a doula. Jamie, thanks for being here.
Thank you for having me.
So I want to start way back to the very beginning of how you chose nursing as a profession. You're in high school, you're going to college. What's that like?
Ever since I was a very young child, I was always interested and drawn to caring for other beings, mostly animals at that age. I was really interested in becoming a veterinarian. I loved Diane Fossey. I thought I would go into the jungle and save animals and protect them in the jungle. But by the time I got through high school and was looking at college, I really didn't know what I wanted to do. I went to the University of Colorado and was originally majoring in environmental, populational, and organismic biology. I just thought that was a good start to just very broad. It allowed me a lot of options in the sciences, which I loved. So after my freshman year, my mom had to have brain surgery, and I was with her through that process. And after her surgery, I was with her in the intensive care unit, and I was watching her nurse, who was only a few years older than me at the time, take care of my mom. And that's when it clicked, and I realized, that's it. I want to become a nurse. And so I went back to school again that fall for my sophomore year and spent that year just trying to kind of figure out, where was I really going to take the leap and go into nursing? What was this going to look like? And
all those science prerequisites, so that must have helped you.
Yeah, I had all that baseline stuff kind of taken care of, which is why I went into that field, because I knew I wanted to do something in the sciences. So I knew wherever my journey took me, I was probably going to be on that path in some capacity. So that was a benefit in terms of transferring my major and my college. So I ended up coming to Northern Michigan University for the nursing program my junior year and went through their entire program here. And my senior year, I ended up getting an externship while I was still in school in the intensive care unit. So it was almost like on-the-job training while you're still a student. I was paired up with one nurse the entire summer on his shift, on his entire schedule. And that was so valuable because I was really immersed in that entire world while I was still in school. And so by the time I graduated, I just transitioned straight into my role as a RN in the intensive care unit.
Wow. I was a neuro ICU nurse. That was my specialty. So what kind of brain surgery did your mom need?
She had what's called a cavernous angioma, and it's like a cluster of blood vessels that would bleed in her brain, which that in itself didn't cause a problem. But when the blood would get reabsorbed into the brain, it would leave an iron ring, and that iron ring would cause seizures. And by the time she had that surgery, she was about 40 years old, and she was seizing pretty much every day, maxed out on all her medications for trying to prevent the seizures. So it was a long journey for her. I mean, it was like 10 years of dealing with that and them just getting worse and not responding to the medications. So that it takes a lot to go into brain surgery and feel comfortable with that being the next step. And so she was at that point.
Wow.
So, and it helped.
I'm sure she was so proud of you. So you graduate from Northern Michigan University with your Bachelor of Science in Nursing, and then you take your boards, you're an RN, and you go right into critical care because of that externship.
Yes. And that experience with my mom, it really inspired me to go on that path. And in terms of working in the hospital, that is where I wanted to be. I loved the pace. I loved the autonomy that you have as a nurse in intensive care. The patient ratios are lower. Patients are so sick. And so I was really able to just connect with my patient and with their families.
That's what I loved about critical care. I was a med-surg nurse first, and you have 8 patients, and I would have nightmares that like I forgot someone, or I worked on the night shift and there was that one patient at the end of the hallway that I didn't know was mine. Like, I think that there's a different kind of an adrenaline with that versus the adrenaline that you get when you're like, okay, this patient is coding, or this patient is circling the drain or bleeding out. Like, when you're focused, when you get to focus just on that 1 or 2 people in critical care. I much preferred that.
Yeah.
Over that like med-surg stuff. And you jumped right into it.
You did. Looking back, I'm like, how did I do that? It really was beneficial to be there before I graduated. And it was just kind of like a treat in that sense of like on the job training. And then I transitioned into that role as a nurse.
And for critical care, you probably needed further certifications like ACLS. Did you do like CCRN?
Oh, yeah.
Any of that?
All of that. We needed to do
all of that.
a lot of additional training. They told us, plan on it feeling like you're still in school for another year, just with all the additional training and certifications you had to get.
I think so many people don't understand even that level of like further education that critical care nurses are getting.
Yeah.
So you're here in Marquette, you're working at Marquette General, or what has changed names a million times. You're working in critical care, and tell me like sort of about that part of your life.
Yeah, so I was in the ICU working critical care, night shift, and I knew that was perfect for me at that time. I also knew very quickly that this wasn't my long-term career path.
How old are you at this time?
I was in my early 20s. So yeah, I stopped in the ICU when I became a midwife. And so I was about 29 when I was transitioning into my career path as a midwife. So yeah, I'm in my early 20s, and quickly, like within that first year or two in ICU, was kind of exploring like, where else, what do I want to do with my nursing career, or where do I want to go with that? And there had been little seeds planted along the way, introducing me into midwifery throughout my life. And the first was from my Aunt Lynn, and she gave birth while I was a freshman in college and with a midwife. And so she told me at that time, I was like 19 years old. She's like, Jamie, you should be a midwife. And I hadn't even heard what a midwife was. I had no clue what she was talking about. And so she introduced me to that. And so my Aunt Lynn having her baby with a midwife while I was in my freshman year of college was really the first time I'd heard of a nurse midwife, had heard of a different model of care for pregnancy and birth. And she kept encouraging me to become a midwife. Wow. And at that time, I was just like, I don't know, it wasn't the time. And so I was still on this journey in biology, and then I transferred, like I said, to Northern for my bachelor's degree. And the director of nursing at the time was a nurse midwife. And so during my OB rotation, she came and spoke to one of our classes, and she's speaking to the midwifery model of care. And I'm sitting there and I'm like, wow, this just keeps re-entering. I was so intrigued. Again, it was like something that I filed away. And then moving forward, after I became a nurse, I was working night shift in the ICU, and I was at the library, and I saw a midwife working at the coffee shop there who I just read an article about and the that she was attending. And so I went up to her and I said, "You're a midwife." She said, "Yes, I am a midwife." I said, "I just read your article and I think I might want to become a midwife." And she invited me to a home birth that she was attending.
Wow.
And she said, she invited me saying, I have to ask permission, of course, from the family, but if they're open to it, like, you're welcome to attend this birth with me. I was open to wherever this was going, and I ended up attending that birth with her. In the world of birth and midwifery, we call these types of births just butter births. I mean, it was like the most smooth, beautiful birth you could imagine. That was my entry into the birth world and into midwifery. So after that birth, she gave me a book on midwifery. I read it, and she said, you should go to a Midwifery Today conference. And I think it was like later that week. I last minute found one that was happening in Eugene, Oregon, and I flew out there with the intention of I am going to just talk to as many midwives as I can and decide if this is the path I want to take. It was kind of that deciding moment for me.
Yes.
Am I going to do this or not? And so I went out to Eugene to this conference, and I talked to midwives from all over the world and all different types of midwives. So certified nurse midwives, direct entry midwives, lay midwives, certified professional midwives. And during that conference, I realized my path was going to be a master's in nursing, a certified nurse midwife. And my reason for that was that I was already a nurse, so it kind of made sense to continue my degree into a master's degree, advanced nursing practice degree. And also, in talking with these midwives, the different types of midwives, I wanted my care to be able to follow women through the lifespan. So I didn't want to be confined to just the childbearing years. I wanted to see them from the time they were teenagers up through menopause. And so that was really important to me that I was able to be with women through their entire lifespans.
So being a master's level nurse you don't say nurse practitioner, you say nurse midwife. Even though a nurse practitioner has a master's degree in nursing, it's just sort of in a different arena. So nurse midwifery has really probably changed so much.
Certified professional midwives and certified nurse midwives in our country are the two that are licensed and recognized by the state. So
you have to apply for a license.
Yes. So nurse midwives are licensed in all 50 states.
So you are now inspired, having attended this butter birth. And then where do you go to get your master's degree?
So I went to Frontier Nursing University, which is based down in Hyden, Kentucky. And the program was the first distance education program, I think, in the country. So at the time that I did it, it was still kind of foreign. Now this is like everybody's, with COVID, it's become very much the norm. But at the time, it wasn't as common. But the program is front loaded. So you do all your didactic courses in your own community at home. I had a graduating class. We moved through the program just like you would any in-person university, master's degree program. But we were all in our own different communities, doing it all online and with group chats and, things like that. We did have to go to Hyden at the beginning of the program to get oriented, meet our professors, meet each other, do some hands-on stuff. And then you go back, do the work at the didactic courses. And then midway through the program, we went back, did pretty intensive hands-on training with simulation labs and things like that, some work on each other. And then when we reached the point of our clinicals, the idea, the way that Frontier started was those students could go back to their hometowns and do their clinicals in their home communities with the nurse midwives that were already there. That was not the case for Marquette. So I did not have children yet. So I was fortunate to be able to explore my clinical opportunities wherever. So I was able to go wherever I wanted to. I could create my own clinical experience. And they had to approve your sites. But I went to Washington, D.C. and trained at a freestanding birth center and home birth practice that had been business for almost as long as I'd been alive. The midwives that I trained with that started that birth center wrote the home birth handbook for the American College of Nurse Midwifery.
Wow.
So it was a huge, incredible that I was able to train with them. I felt so lucky to be there.
Yes. I know that we both love our children so much, but what a unique opportunity in your lifespan, that at that moment you could go anywhere.
Yeah.
Because training with the women who wrote the book, literally when you think they wrote the book, that must have been an amazingly spectacular experience.
Yeah. They are in the nurse midwifery world. Everybody knows them. And so it was such an honor. And there was so much wisdom there that they could share with me. And I still keep in touch with them. I love them so much.
That's awesome.
And then I finished up my training. I knew that home birth, out of hospital birth would really only give me experience with very healthy women.
Mm-hmm.
And so I wanted to also have experience with higher risk populations that were still seeking midwifery care. So then I went to Dartmouth Hitchcock, and they had a nurse midwifery service of 8 midwives on staff. That practice maintains care of pretty high risk women, and they all birth in the hospital, of course. So I had a completely different experience there, which was equally as valuable to just get such a well-rounded experience.
I didn't know all this.
Yeah.
I mean, wow. It's amazing you had all this experience.
It was wonderful. I feel very grateful.
So you are in DC and New Hampshire, and you have all this amazing experience. Why did you come back to Marquette?
Well, my husband and I had started our early married life here after I graduated from nursing school. He came here when he graduated from the University of Colorado. We were already dating, so he came here to be with me until I finished my nursing program. And our plan after that was really to probably go back out west, and I was I had these dreams of being a nurse out on a ski mountain or something like that. But life has its own different plans, and he ended up buying a business and starting a business here. So while I was off doing my clinical training, he was still here holding down the fort for a little yellow lab and working. I returned to Marquette to really continue to build our lives here. Very early on in our time in Marquette, we became very ingrained in this community. We just knew this is where this was home for us. Neither of us grew up here. It's kind of a middle ground for both of us. I grew up down in the southwestern corner of Michigan. He grew up in Vermont. And so it was a place that was really just ours. We're both musicians. We got deeply intertwined into the music community here. And so this was home. And I really was passionate about bringing midwifery care to our community. So I could have really gone anywhere and gotten a job, but that wasn't what was important to me. What was important is trying to build this here.
Yeah, because you couldn't even do your clinical rotation in Marquette. There was no nurse midwife to do it with.
Not in this area.
No.
Yeah. When I came back, there was a nurse midwife on the western end, the eastern end, and then me right in the middle. Thankfully, that is changing. There are a number of midwives in the Upper Peninsula now, so it's exciting.
So you come back to Marquette at that time, and what do you do for work? What do you do for a job? What does that look like?
Yes, it was a bit of an unknown. I reached out to pretty much every practice and everyone I knew and just kind of let people know I was here. I ended up getting my first job as a nurse midwife was at Planned Parenthood. So I was doing full scope women's health, some men's health, a lot of birth control, infection screening, problem visits, so breast or uterine concerns, pelvic pain, and just your general well women care. So a number of years into working at Planned Parenthood, an OB at Bell Women's Care reached out to me wanting to bring midwifery into their practice. And so I ended up working with Bell Women's Care on the clinic side of things. So again, doing full scope women's health, everything I was doing at Planned Parenthood, but then also having the joy once again of working with the pregnant population. So prenatals, postpartums, breastfeeding support, and got to do the more perinatal side of midwifery again, which was wonderful.
So you were in the clinic side, meaning that you were not in the hospital itself. Did you attend hospital births at that time?
I did not. I was having my own babies at that time. And once I had my first baby, while I was at Planned Parenthood still, I quickly realized that as much as I'm passionate about midwifery, I also really wanted to be home as much as possible with my family. And so I did not want to get into being on call or working holidays and things like that, which is, of course, part of midwifery care. So I chose to stay on the clinic side of things so that I could have those regular hours during that time of my family's life. So kind of a shift, unexpected emotions that came up after I became a mother. So
oh, yeah. I mean, it's been really hard for me as a working mom to sort of balance this and, make choices and decisions. And our children do become our absolute first priority.
Yeah.
I mean, I remember, and I am going to use this name, Leanne Hatfield was my doctor. And I remember her telling me that she was going to stay home with her children. And I was selfishly devastated. I was like, what? No, I'm like, no, you can't. You can't. And she was like, Stephanie, you get this. And I was like, I do get this. I do. Absolutely.
It's hard. And you don't know how you're going to feel, until your baby comes, and then things really shift. It was unexpected, I think, to a degree. And then it's been a good practice too of just having perspective and patience and knowing like, this is just a season of life. And, this is what this season looks like. And that may change. And the way midwifery looks for me is going to change through my lifetime.
So you now have 3 children, and you sort of probably, and you can tell me if this is not correct, but you slowly sort of decreased your hours through Bell, slowly, maybe became like PRN. Is that sort of how that you have your second child and then your third, and you're just slowly decreasing your hours there?
Yes, I was working consistent part-time hours until my youngest was about 10 months old. And then I shifted down to contingent work with them, which was perfect because I still had that piece of me there. But we are also a homeschooling family. So I was able to be present in that capacity, which requires a lot from the main parent that's doing that work with the kids. And so that for a while was just like the perfect balance, became the perfect balance. But it was hard because with contingent work, I lost that continuity of care with the women I was seeing. And that's the piece that really fills me up, is having those relationships over time and being able to follow up with them. So contingent work for me was really hard. It was anxiety provoking and stressful because I want to be there through the whole process of whatever it is that they're going through. But it worked for that time. And then around the time of the pandemic, I was home full time and trying to take a step back and get a bird's eye view of what is working, what's not working. I gotten into a place where I didn't know if midwifery was still my path. I had to step back and be open to whatever was going to happen. Am I meant to teach fiddle? What am I doing? I don't know where this is going. And at one point I said to my husband, I think maybe midwifery, I'm closing this chapter of midwifery. This is done for me. And he just looked at me and he said, Jamie, every time I walk up on you having a conversation with a woman, you're talking about pregnancy, birth, breastfeeding, or some women's health issue. He said, I don't think this is done for you. And so I had to laugh. It was so true. It is. It's just part of who I am. I mean, it truly has been a calling for me. This wasn't something I chose. It was something over time that just kept coming back into my life unexpectedly and uninvited. It truly came to me, I feel like. And it does feel like a part of who I am, not just a career choice or a job.
Absolutely. So this brings us to your new business called Rooted. And I feel like I have a Yooper accent when I say that. Rooted.
Yeah. So during the last few years, really became passionate about diving deeper into the postpartum period. And that came both from my own 3 postpartum journeys and through my experience as a midwife, caring for people postpartum, and just knowing that there's a huge gap in care there and we are not serving families in the postpartum. There's so much progress that's been made and so much attention spent on the pregnancy and preparing for giving birth, but then nobody's really talking about postpartum and what that looks like as the birthing person, what that looks like as the partner, what that looks like as a family unit. And there's just a lot of struggle there that doesn't get talked about and goes unnoticed. And it's very isolating and a lonely place for people to be. So a few years ago, I got certified in perinatal mental health. I wasn't working at that time. I didn't really know where this was going to go, but I thought, I'm going to do this and just kind of see where it takes me. And shortly after that, I connected with Upper Peninsula Healthcare Solutions with this idea. The initial idea was to bring training through Postpartum Support International, which is where I got certified through, bring those trainings to Marquette. I was so passionate about that. I thought, more of our providers here would benefit from this training. We all want it. We need, you know, many of us recognize these gaps, but we just we need more training in this area. And it's hard to travel. We're very isolated. So let's bring it here. You know, and virtual only gets you so far. Like being in person is just so valuable. So from that idea grew this idea to have a work group through UPHCS that meets monthly to address these issues. And so now I co-chair along with my business partner, Heather Sullivan, which is actually how we met, being brought together through this work group. We meet monthly and bring professionals in the community who work with the perinatal population in any capacity. So we have pediatricians, nurse practitioners, doulas, social workers, therapists, lactation consultants, people from the health department, people from MC3 downstate, which works with perinatal education. We all come together once a month with the intention of, initially, is really figuring out what the barriers are, where the gaps are. And across the board, everyone coming was saying, we need more training, we need more education. And so that's been a big goal of ours, is to do lunch and learns during our meetings. We did bring that Postpartum Support International training to Marquette last fall, 3-day training, get more people certified in perinatal mental health. At the start, when I got certified, at the time, there was only 2 or 3 of us certified in perinatal mental health. And now through that training we did last fall, there's a number of people I want to say up to 20 to 30 people that have been certified in perinatal mental health as a result of that 3-day training being brought to our community. We're also it's a great place for networking, and we are really making an effort to streamline the referral process. So often it's, you have a patient in the office and you've got 15 minutes with them, and we all know this is postpartum depression and you need more support, but it's a 3-month waiting list to get in anywhere. So really trying to help people get the care they need at the time that they need it.
Yeah, absolutely. I don't want to get us off track, but I had never heard of UPHCS. I had never heard of Upper Peninsula Healthcare Solutions. Can you tell me what that is?
Yeah, so that is the nonprofit side of UPHP, which is our Medicaid provider for the Upper Peninsula.
Okay.
So UPHCS, the healthcare solutions side of things, addresses healthcare needs, disparities for the entire Upper Peninsula in all aspects of health. So I'm deeply involved in the perinatal side of things, but they do any type of health need a person may have. They're addressing that on more of a systems level.
Interesting.
And they have, their support is just so broad. So I'll come back to them as well, because our business Rooted, which you had mentioned earlier, we got a grant through them.
Wow.
For our services. So they help businesses such as ours provide services to our community.
Yeah. So you, as Rooted, you are these 3 women with very different specialties, and you are offering classes, help. Tell me a little bit about what this offering is that you guys are.
Yes. So the 3 of us came together a year and a half ago after working. We've all known each other in various capacities for a while, but we had all been a part of this work group that I talked about, the Maternal Family Wellness Work Group, for, at that time, over a year. And so we came together one day after one of our work group meetings, and with this shared vision of offering a postpartum service that was accessible to anybody, specifically in home. We wanted to be in the clients' homes. And so we just came together with our varying backgrounds and our varying personal experiences. Between the 3 of us, we have 9 children, and we have all these different experiences with our own postpartum journeys. So we came together with this shared vision, and out of that came Rooted. And so we are offering clients 4 classes during pregnancy that cover postpartum planning. And the 4 classes cover the topics of postpartum mental health and relationship adjustment, postpartum physical recovery, infant feeding and lactation, and then a class that's specific to the dad, the non-birthing parent, the partner. And that's specific to them, and they're honoring their own transition and also how to best support, to anticipate what their partner is going to be going through after giving birth and what postpartum might look like. So those 4 classes occur during pregnancy, and then postpartum, we will continue seeing them in their homes through the first approximately 4 months postpartum. So we really wanted to get through that transition that many women are going back to work, and the clients will get 3 visits from each of us. So that we feel the benefit there is we're all coming to them with a different lens. You know, the lens of a nurse midwife, the lens of a social worker, the lens of a doula. We're all going to be looking at these situations through these different lenses.
And you've each had your own different experiences with being mothers, your own different experiences with, like, you could probably talk for 4 hours on each child and each child's birth and how the postpartum period was different. And I mean, that could literally be our like 3-hour conversation. I mean, it's so, don't you think it's so different? Every mother, every child, every circumstance. There is no cookie cutter birth experience.
No,
it doesn't exist.
No. And that's why the support, it's whether or not you're a first-time parent or this is your 6th baby, like each journey is different and there's different challenges that come up and different needs. So we're hoping to, be there for whatever that journey looks like. There are other postpartum home visiting services in our community that are offered, but oftentimes they are for families that are qualifying for Medicaid. So again, there's this gap for people that maybe don't qualify for those services, can access them.
So I can so see the value of this home visiting. I mean, I remember when my first son was born and my husband went back to work 2 days later. I had no family in the area. And ironically, I wasn't working at the time because I was finishing up chiropractic school. So I was literally in a town where I knew no one. But I may have said something like, but I could never have afforded a service like Rooted. Is there help for someone who doesn't feel like they can afford it?
Yes, we have been committed to ensuring that our services are available to anyone that needs them or wants them. So we were able to get a grant through Upper Peninsula Healthcare Solutions to be able to offer clients a sliding scale for our fee. And that we have like a welcome letter that clients will receive, and they can just kind of assess themselves where they fall financially and what they can afford to pay. And then the grant will supply the rest of that. So at this time, we are not accepting insurance or Medicaid. And so this was because of that, we were very passionate about finding grant funding so that this wasn't a service just for those that can afford it.
That's amazing.
It's really important to us. Yeah.
That is so cool. So how does somebody find you? How can someone reach out if they're like, oh my gosh, this is for me, or this is for my family, or maybe someone is listening even from another country and they want to learn a little bit more about nurse midwifery or this postpartum care or the mental health step? How does somebody find you?
They can find us on Facebook, Instagram at Rooted MQT. Our website is rootedmqt.com. They can email us at rootedmqt@gmail.com. So it's pretty consistent.
I love it. Rooted MQT.
Yeah.
Just look for them on socials anywhere. Jamie, anything else that you want to share as we close our time together? Anything else that you really feel a burning desire to share?
I just really appreciate you having me here today and offering the space to talk about the postpartum, midwifery, of course, but then the postpartum care. And
so, I for sure after my first baby suffered postpartum anxiety. Like
it is so common for people to be struggling postpartum and feel so alone in that because people just aren't talking about it. And so that's what with Rooted, we've been so passionate about shedding light on this time and the struggles that families go through and trying to help people not feel so alone in that. We know that postpartum depression, anxiety is really common. It's not normal, but it's really common. And yet when you find yourself in that, you're so alone in it oftentimes because nobody wants to talk about it. And so you feel like a bad mom, or you feel like you can't ask for the help that you need, or maybe even recognize it because there's not that support system in place. Statistically, we know that 1 in 5 women have postpartum depression, anxiety. 1 in 10 dads or the partners have depression or anxiety. So those are really high statistics. And we know that those are even higher because that's just what's being reported. We feel just so passionate about bringing this out and bringing it into the open and having people talk about it, trying to decrease the stigma surrounding the struggles of postpartum and postpartum mental health, just help people not feel so alone in that journey. It's such a sacred, fleeting time. And So the quicker you can have the support you need, get the help you need, just be encouraged in that process, to be able to be present through that fleeting time is just so important.
Yeah, absolutely. And for it not to be so stressful that you miss out on the beauty of it. You know, like my son is 18 and he just graduated from high school. And I had this mom with this screaming baby, and I knew she was just like at the end of her rope. And you remember the stress, you remember the anxiety, you remember. But could we give a little more space to remember the beauty of it all, the enormity of it all? I think culturally we're missing. Oh, you had a baby, you should be happy. Bye-bye.
Absolutely.
I'll see you at 6 weeks for a very basic medical check. Like,
Yeah.
how are you? How are you in this relationship with your partner? How are you in this relationship with your new baby? Like, let's give some space for that. That literally could change the world, human after human.
Absolutely. The wise nurse midwife I trained with in DC at the home birth practice, she said, I was talking to her recently about Rooted, and she said, people in our culture don't know how to do postpartum. And there's so much pressure to just get back to work, hold down everything you were holding down before this new human entered your life. And the strain, that doesn't work. It takes away the beauty of that time when you're just feeling the pressure instead of just soaking it up. So how do we support families so that they can just soak up that beauty of that time?
Absolutely. I'm so glad that you guys have created this business Rooted, because I think that this community, and really many, many other communities in the world, are going to be so benefited by this work.
Thank you.
Thank you for being on this podcast, Jamie.
Thank you so much for having me.
Thank you so much for listening. If you've enjoyed this podcast, would you please rate it, review it, like, or subscribe? You can find me on social media at wautierwellness.com, Dr. Stephanie Wautier on Instagram, or Wautier Wellness Chiropractic and Massage on Facebook. And I'm so curious where your next conversation will take you.